Tremors in hand, stiffness in muscle, or a shaking body, all of these could be the first symptom of Parkinson's. But unfortunately, due to the less awareness, this brain disorder remains undiagnosed, and as a result, the situation keeps getting worse over time. So, hello everyone, I am Dr. Purudavan. In today's video, we shall discuss the symptom of Parkinson's disease. Let's begin the video now. So, the sign and symptom of Parkinson are divided into two categories, motor and non-motor. First, let's discuss the motor symptom. These are clearly visible and noticeable in the person's body movement. For better understanding, let's look at some example. First, tremors. Tremors are one of the major signs during the onset of Parkinson's. The patient might experience shaking in the hands, leg, or even head, especially when they are resting. Secondly, the muscles become stiff, making the body movement very difficult and slow. As a result, the patient starts taking a longer time to do even simple tasks like turning the neck or picking up an object. Next is the imbalance in the body. Patients often lose their sense of balance, which create difficulty in the walking and makes them prone of falling. Some patients might also feel changes in their normal walking patterns. Moving further, now let's discuss the non-motor symptoms, also known as hidden sign of Parkinson's. Why hidden? Because these signs are not visible in the body movement and are only felt by the patient. For example, continuous depression. Let's have a look at some major non-motor symptoms. So the first one is the poor gut health. Actually, the Parkinson highly affects the muscle movement. Now the gut also has muscles which contribute to the process of digestion. But when the gut movement is affected, this results in poor digestion, creating issues like bloating and constipation. The next major symptom is sleep disorder. Sleep issues may occur due to lots of stress and anxiety. Moving further, hallucinations are also common. The patient starts feeling the presence of another person around them who is not present in real. Apart from this, they may also feel mental confusion due to weak memory. They may become confused about simple things like they might not recognize an old friend, or they might forget where they kept the phone few minutes back. Moving on, the next is the mask face formation. Now, what is this? Parkinson affects the nerve controlling facial muscles, making it hard to show expressions. This causes a blank or emotionless look even when the patient feels emotions inside. Last but not the least, speech problems. The voice of the patient becomes soft and monotonous, making the voice sound too dull and flat. So now we have covered almost all the major symptoms of the Parkinson. Moving further, it is important to discuss the special tips to prevent the progression of this disease. But what are those special tips? First, focus on preventing brain damage, and secondly, boost up the dopamine level. Let's discuss now deeply. First, have a proper medication. Medicines plays a very crucial role in controlling symptoms and slowing down the disease progress. The patient should not skip any of their medicines. Second is diet. Have a healthy diet having dopamine boosting foods such as bananas, watermelons, nuts and so on. Apart from this, make sure to incorporate brain enriching foods like walnuts and almonds and help nourish the brain cells. Third, regular exercise. Make it a habit to exercise daily. There are many simple activities like walking, yoga and meditation which helps in improving the blood oxygen supply to the brain. Here with this last step, we end with this video today. I think we covered enough symptoms today highlighting the urgent need for a proper diagnosis. If you or a loved one is experiencing any of these symptoms, do not ignore them. Take the proper steps today to slow the progression of this disorder. See you all in the next video. Till then, take care, bye-bye and namaste.